Hi guys, welcome to my channel. My name is Eman and this is NICU Nurse Faith. So this is the first video on my channel and I'm really excited. I'm a little bit nervous, but I'm really excited to be able to share my experience with you guys. In this video, I'm gonna first talk about my inspiration of my channel and then I'm gonna talk about my pregnancy story. So the inspiration for my channel is that I am a NICU nurse and I've been a NICU nurse for the last 7 years in Western Canada, and I recently became a NICU mom 2 years ago. So because I have that unique experience from being in both worlds, being a healthcare professional and then also becoming a patient in the same world, the NICU world, I've gained specific insight and specific experiences that I believe I can share with NICU parents that are going through NICU right now. Through my channel, I would like to empower parents through knowledge of the NICU, being a healthcare professional and being a NICU mom, and just provide some advice to help parents navigate this world. I found out I was pregnant September 2017. This was my first pregnancy. I was really excited. My family was excited. It would be the first on my side and I believe 5th on my husband's side. So everybody was just so excited and everything was going well. My first trimester was really good. No symptoms, no morning sickness, nothing. At 11 weeks, I noticed that I was spotting. The first day I was spotting a bit and then it went away. And then the third day, I was bleeding a lot more. And I had no idea what was going on. As a nurse, I knew that this was a worrisome sign, even though bleeding is common in the first trimester, but I was extra cautious. So I went into the emergency department and we did an ultrasound and the baby was fine and they noticed I had something called subchorionic hemorrhage. So this was the first time me ever hearing this. I've never heard this as a nurse. I've never heard this as a woman from my family or friends. Never heard anybody going through this, the subchorionic hemorrhage. So this was a first for me. So I did a lot of research on what it is and I've learned a lot about it. Comment below if you would like a video talking about what subchorionic hematoma or hemorrhage is. So I was told that the baby was fine, baby was growing. This was 11 weeks, but I still had a bit of bleed underneath my placenta, where my placenta was going to be. So I was monitored every 4 weeks to make sure that hematoma was getting smaller. My doctors told me either the hematoma, my body would absorb the hematoma and it would go away, or I would bleed out the hematoma. So basically what happened with me is that I ended up bleeding. So it's from 11 weeks to 17 weeks, so almost 5 weeks, I bled every day. A little bit more like spotting, more than spotting, but definitely every day I bled. And so I knew that I was bleeding out the hematoma. And so every morning, whenever I saw blood, I was not worried because I knew what it was. It was scary. It was very scary seeing blood when you're pregnant. But I just knew this is what my body was supposed to be doing. At the same time, my blood was getting darker. So at the beginning, my blood was pure red, fresh blood. And as the weeks went by, it was getting darker. So I knew my body was healing. At my 20-week ultrasound, which is the full anatomy ultrasound where they look at the whole baby, they noticed that the hematoma was gone, completely gone and healed. They can even see the healing. So that was a good sign. So I was so grateful for that. So after my 20-week ultrasound and my hematoma has fully healed, I had no bleeding, no problems. I felt well and everything was going well. I had no other concerns. So that would have been from 18 weeks up to 28 weeks. Everything was going well. Everything, yeah. The only thing that they noticed is at my 20-week ultrasound, my baby was measuring smaller than normal. That's the only thing. Otherwise, he was growing. He was just a bit smaller. So because of that, my doctor just wanted to double check the baby's growth. So she sent me for another ultrasound at 28 weeks. Usually, if the mother is low risk, the mother is healthy, you usually have a dating ultrasound at the beginning, which is usually 9 weeks. This is in Canada. Usually in Canada, this is how it works. Usually you have a dating ultrasound at 9 weeks. You have a 12-week ultrasound to look for any genetics concern, and that's your choice. You don't have to do that one. And after the 12 weeks, the next one that most people do, everybody does, is 20 week. The 20-week ultrasound goes through the whole anatomy of the baby from head to toe. After the 20-week, if everything looks good, you don't have another ultrasound until your 3rd trimester. So that's what usually the schedule is like for moms that are low risk, that are healthy. From my 20-week ultrasound to my 28-week ultrasound, I felt well. No bleeding, no cramping, no concerns. Yeah, I was working. I felt really good. And then so I just went in. I worked a night shift at the hospital, and then I went in. It was actually 29 weeks that I could get an appointment, and I went in to get my ultrasound done. So as soon as I went in, they did the ultrasound. My husband was there. They did the ultrasound, and the technician just left. And so I knew something was off, something was going on. As soon as she left, the nurse came in and took me and my husband to a quiet room. I knew right away. I knew they saw something as soon as they take you to a quiet room. So me and my husband were waiting in the quiet room, and the doctor came in. The perinatologist, I believe, the perinatologist came in. These are the doctors that study the ultrasound photos, the baby ultrasound photos. He came in and he basically told me that my baby was not growing, that my baby was IUGR, and he was much smaller than his age. He was growing, but he's much smaller than what he should be at 28 weeks. And then he told me that he had a feeling, and so he looked at my placenta, and right away he caught it. And I had placental insufficiency. So that's why my baby wasn't growing as well. So basically, what placental insufficiency is, the placenta is not doing its job properly by providing enough nutrition and perfusion to the baby so the baby can grow. So because the placenta is the lifeline between the mom and the baby, I was automatically considered high risk, and I was hospitalized. So I was told I was gonna have a premature baby right away. I knew I was gonna have a premature baby, but because being a NICU nurse, I wanted to keep my baby in as long as possible. So I was admitted that day, and from 29 weeks to 31 weeks, I was in and out of the hospital from antepartum. So I would come home for a couple days, and then I would go back to the hospital for a couple days. I just did not want to be in the hospital for the full 2 weeks. Like, those hospital beds are horrible. Like, they are so uncomfortable. Like, I feel for those patients now that I used to take care of in adults that are always in hospital. It is not fun being in the uncomfortable bed, being alone, not knowing anybody. So I just had a whole different appreciation being a patient. But my doctor allowed me to come home a couple days, sleep in my own bed, and then I would have to go back for a couple days to be monitored. So I had ultrasounds every day to make sure my baby was okay. And every day they can see my baby getting stressed. And the Dopplers, which is the perfusion of the placenta, and the blood flow and all of that changing every day and getting worse. Otherwise, my baby was moving. He was kicking, but the ultrasounds were getting worse every day. So that was up to 31 weeks. And then at 31 weeks, while I was in the hospital in antepartum, I ended up getting a rash, a pregnancy rash. It started in my belly, around my umbilical, my belly button, and it just went all over my belly, down my thighs, my feet, my arms, everywhere, neck down. I started to get this rash. In 6 days, that rash was everywhere. It was itchy, it was raised, it was hot, and no one knew what it was. At the beginning, my OBs thought it was PUPS, but because it got worse so fast, it actually ended up being something called pemphigoid gestationis. So that's another one of my videos that I want to do, is talk about what pemphigoid gestationis is. So comment below if you would really like to see that, or if you've heard about that. I would really like to see if anybody has even heard about it or even encountered it, because pemphigoid gestation is a very rare pregnancy rash, which I end up getting. So I'm so grateful now. But looking back, my pregnancy was really interesting. So at 31 and 1, I ended up getting that rash. From 31 and 1 to 31 and 5, it went all over my body. we could not control it. So my OB came in the next day. She was there at the ultrasound, and she told me that this rash is connected to a small baby, and it's connected to placenta problems. And because this rash was getting out of control, she was worried about my baby's safety, and so that's why she wanted to take my baby out. Basically, I had a C-section, and my baby was born the next day, 31 and 6, almost 32 weeks. I had a C-section, and my son Bilal was born. So that's the reason why he had to come out early. If I did not have the rash, I probably could have kept him in longer inside, but because he was getting stressed out, and on top of that, I had this really rare and worrisome rash, my OB was nervous, so we just decided to take the safe route and take my baby out. So he was born on April 13, 2018 at 1310 grams, which I believe is 2 pounds, 16 ounces. I believe, yes. I'll put that up here. And he was really small for his age. He was almost 32 weeker, but doctors were telling me that he was actually the size of a 30 weeker because he was just so small. So he came out screaming, and I was on the table, sliced open with C-section, and I actually had my NICU team that I work with come in and resuscitate my baby, provide some breathing support, the temperature support, and take my baby to the NICU. The team that I work with at the hospital is amazing, and I was so grateful that they were there to take care of my son. But it was scary being on the other side, seeing him being taken away. After my C-section, I went into the recovery room, and after an hour, I was able to get wheeled in to the NICU to see my baby. And just being wheeled in to my workplace was such a, I don't even know what the word is, such a weird, like not real feeling, being wheeled in a stretcher, because I see moms being wheeled in every day when they come to see their baby. And I was literally being wheeled in, and I see all my coworkers there, all smiling, all shocked. They didn't know it was my baby. And it was just an unreal feeling being on the other side as a patient. So I was wheeled in on a stretcher, and I saw my baby, and I had my coworkers around me, and they were asking me, they didn't even know it was my baby, and they were just seeing how I was doing, and seeing him for the first time was amazing. I knew, being a NICU nurse, I knew he was doing well. He didn't have as much wires. He just had one IV. He had a breathing machine. He had one IV. Otherwise, he was doing well. So I knew, just based on the way he looked, he was stable and he was doing well. But it was an unreal feeling having my baby in the isolate where I take care of thousands of other babies. So I saw him, he was stable, and then I got wheeled to the postpartum. And so I was in postpartum without my baby, and I was in postpartum for 2 days. And while I was in postpartum, every day I would walk to NICU, hold my baby, and I would walk back. I would be pumping every 3 hours. I have a whole new appreciation for moms that have their babies in NICU that are separated, because that is one of the hardest feelings, to be separated from your baby, and that you still have to provide breast milk, you still have to provide support and try to be there for your baby, but you can't always be there. So that was one of the hardest things. And then being discharged and going home and then coming every day was another hardship that NICU parents have to go through. So I've definitely learned a lot being on the other side as a NICU mom. So my son Bilal, was in the NICU for 4 weeks, from almost 32 weeks to 37 weeks. They wouldn't let him go unless he was above 4 pounds. So he was there for 4 weeks, and his biggest problem was feeding. He just was throwing up a lot. He was having a lot of regurges. Because he's an IUGR baby, Intrauterine Growth Restricted, those babies have very low, they don't have as much perfusion going to their belly. Because they're so stressed in utero, the perfusion goes to their heart, their brain, and their heart to keep them alive. So very little blood goes to their stomach. So when they're born, those babies tend to have a lot of throw-ups and vomiting. And that's what my son had to go through. For the first 2 weeks of his life, he's vomited a lot. He could not keep any milk down, nothing. Lost a lot of weight. So we had that was our biggest problem. And he was just small for his age. So after 2 weeks, once he starts tolerating my milk, my breast milk. He started growing, he started eating. I was breastfeeding, and I was breastfeeding, and he was getting milk through his feeding tube. So I was doing both. With my experience, I had a hard time latching. So what I did is I pumped every 3 hours, and I gave that through bottle. So he came home on full breast milk through bottle. And he came home on May 18, 2018. That was actually the day Prince Harry and Meghan Markle got married. That was their wedding day that he came home. So he came home that day, and since then he came home really small, 4 pounds. He was always on the smaller side, barely on the growth chart. I believe 15 months is when he finally caught up to kids his age. So he's always been small at the beginning of his life, and then he eventually did catch up. And now he's healthy, vibrant, amazing boy. I'm so grateful that he's here. But just being on the other side, I've learned so much that I believe I can share with parents through the NICU aspect of it, the NICU terms and the procedures, and the parenting aspect of it, what parents going through, the mental health concerns, the separation anxiety. There's the importance of self-care. There's so many things I've learned as a parent that I didn't realize as a NICU nurse that parents needed. So I want this channel to be a safe place where parents, NICU parents, family members of NICU parents, anybody can come on and learn more about this world and how they can support their loved ones. So yeah, thank you for watching. I hope you've enjoyed my video. If you really like this content, please subscribe and punch that like button so you get more of my videos. But just let me know, comment below if you have any questions about anything, and we'll chat there.